Hello, this is Dr. Laura Tigler. Welcome to my channel. This channel is meant to provide good general medical information. It's not meant to provide specific medical advice. Please do see your primary care provider or your primary care physician to obtain medical advice that is tailored specifically for your needs. At the end of the medical information, I will provide a bit of spiritual information. If you do not want to stay for that portion of the video, at the end of the medical information, I will let you know, and at that point you can simply click away. But first, please do like and subscribe. Okay, today we're going to talk about atrial fibrillation, just a few basics. So atrial fibrillation, what that means is the top chambers of your heart, those are called atria. And fibrillation means that the muscle of the heart is beating in a chaotic fashion. Not usually, usually it's synchronized. But instead, the muscle is generating beats from many different points in the muscle, and so it ends up being chaotic, and the blood's not pushed out of the chamber in a beat fashion, a synchronous beat fashion like it normally is. So the atria, they only account for about 10% of your cardiac output. So generally, if the atria doesn't work too well, you can still feel kind of good. Unlike ventricular fibrillation, when the bottom chambers of the heart, because remember there are two chambers on the top, which are kind of small, atria, and the bottom chambers are called ventricles. When the ventricles have fibrillation, a chaotic electrical discharge from many different points of the muscle, it's not acting as a pump, and it provides at least 90% of your cardiac output, and that's how you stay alive. So if your ventricle is in a fibrillation, or that chaotic beating, no blood is being pumped out, and that is sudden death, and we call that cardiac arrest. But we're not talking about ventricular fibrillation in today's video. We're talking about atrial fibrillation. Okay, so I wanted to give you some basics on atrial fibrillation because we are noticing that there is a bit of an uptick in diagnosis, especially in females, for atrial fibrillation. So let's get started. So if you're at risk for atrial fibrillation, if you have obesity, and I would even say overweight, so keep an eye on that. It's not really black and white. It's not like a wall separates ideal body weight from overweight, and then you're overweight, and then there's another wall, like a physiological wall. It's really a continuum. So if you're overweight and you have like fat on your belly, you need to worry about that. You need to try to lose weight and to become fit. So obesity is a risk factor for atrial fibrillation, and then lack of fitness. So if you do some sort of regular exercise every day, preferably not something so strenuous on your knees like jogging, preferably something like walking, some sort of weight training or weightlifting. And remember, I talked about exercise in previous videos. If you're sedentary, we recommend that you start with 30 minutes per day, 5 days a week. That's 150 minutes of walking, moderate exercise. Or you could choose to do 75 minutes of strenuous activity. So 15 minutes strenuous for 5 days. But like I said in another video, you could exercise more. That's perfectly okay. But if you're sedentary, then I would just start with a little bit each day, and then gradually bring up the amount of exercise that you do. But so the two risk factors so far: obesity and lack of fitness, which is correlated with lack of exercise. Hypertension is a risk factor for atrial fibrillation. So please do see your provider or your physician, your doctor, and almost always we check your blood pressure and make sure that your blood pressure is at goal, that it's well controlled. Sleep apnea. That's a risk factor for atrial fibrillation. Many times patients have sleep apnea and they don't complain about it. They don't realize that their symptoms are related to poor sleep. And so it is appropriate, if the doctor or provider wants to do a sleep study, it is appropriate to get that done, even though it can be an arduous, prolonged process. But you do need a proper diagnosis and treatment so that you can have less risk for cardiovascular problems, including atrial fibrillation. Alcohol. So in a previous video, or actually a couple, I mentioned that any amount of alcohol is not healthy. So 0 amount of alcohol is what you're really shooting for. But if you have a little bit every now and then, I wouldn't even go up to what we call moderate. So for women, we say 5 ounces of wine per day, 12 ounces of beer, 2 ounces of liquor. No more than that. That's what we call moderate, but that's even too much. But that's our current definition of moderate for women. And generally speaking, men are twice that. But yeah, I wouldn't even do moderate. I would do 0 alcohol, or a very little tiny bit. Diabetes is a separate risk factor for atrial fibrillation. Genetics, it could just be that you're prone for atrial fibrillation. Men are more likely to have atrial fibrillation than women, but like I said, we are diagnosing women a bit more now. And age. So the older you are, the more likely you are to have atrial fibrillation. The main reason you care about atrial fibrillation is because that chaotic beating of that small chamber, no blood is passing into the next area of the body. So the blood could just pool there or sit there. And if it does that, it could form a clot. We call that a thrombus. And a small portion of that could break off, go up into your brain and cause an embolic stroke. And I will talk about stroke in subsequent videos, but you can look that up, stroke. We use the term TIA or CVA. TIA stands for Transient Ischemic Attack, and CVA stands for Cerebrovascular Attack. Okay, so that was the atrial fibrillation risk factors. And I wanted to tell you that there is a trial. It's called VITAL, like vital signs, VITAL AF trial. And we were trying to see if the devices that you wear, there's a long list of commercially available devices that can track your vital signs. Generally, those devices monitor lead 1. We have 12 leads on an EKG generally, and they generally look at just one of them. But anyway, we're trying to see if the devices you wear, if you should, or even we should in office, use such a device on a regular basis to see if we can catch atrial fibrillation right when it happens. But this trial or study, it wasn't about the devices that you guys might wear. It was actually us checking in office every time you come in for atrial fibrillation with a device that's similar. Okay. Anyway, long story short, this trial showed that there is no benefit to checking for atrial fibrillation for everyone over a certain age, let's say, that we weren't necessarily missing anything. So I'm not saying not see your doctor, please see your doctor, but the vital signs that we currently check are good. Remember, we check heart rate, and we check blood pressure and other vital signs. And then you might have symptoms. So if you have chest pain, or you feel fluttering or palpitation in your heart, then you need to seek medical attention. You for sure have to let your primary care provider or your primary care doctor know any symptoms, any unusual symptoms. So this study says in the office setting, it's not helpful, but there are many reasons why having a device that you wear could be helpful. And I'm sure I will talk more about this in other videos. But I just wanted you to know that we are studying these consumer wearable devices. We are aware of those. We want to incorporate those in the medical risk assessment, and that is beginning to be done. And I can tell you, as a little helpful hint, I personally would like it if the patients make it as easy as possible for me to see the data on their device. So if you can put it into the cloud, and then you can print out a graph paper, something that I can actually access, because as physicians, we might not always have the ability to match your software with our software. And then sometimes it doesn't come up very well on your phone, and I can't see everything. I can't scroll to the left or to the right, for 4 months. So I need some sort of summary. So please do see if you can push it through the portal with your doctor, or contact the manager of the office and see if from your end you can kind of get that compatibility started so we can begin to assess the data that you're collecting. But it's perfectly fine to bring in printed results, whether it's from the cloud or whether you're doing it manually, like the old-fashioned pen and paper. So please do consider using a consumer wearable device. They are highly sensitive and accurate for the narrow data that they're looking for generally. Okay, so that was the Vital AF trial, and you can look online with your favorite search engine and put that in and get to know that one trial. I wanted to give you an example of how we're looking to match your data with our data and make good diagnoses for you. Okay, the pillars of management for atrial fibrillation. The first pillar is stroke risk. So remember, I told you that if you have atrial fibrillation, the main problem is that you're at risk for stroke. But like I alluded to earlier, the atria chamber, it does account for some of your cardiac output. So if you're having a weaker cardiac output, you could feel weak. You could have some symptoms. So there are other reasons why you care about atrial fibrillation. And then optimize your lifestyle habits and medications. Make sure you see your primary care provider, your primary care doctor. And then we do try to manage your symptoms. We try to decrease the burden of having this abnormal rhythm in your atria. We might want to decrease your heart rate. There are about 4 or 5 different types of atrial fibrillation. It could be permanent atrial fibrillation. It could be paroxysmal, which is all of a sudden. And in that case, it might happen once a month. It might happen every 6 months. We even have another category now, which is successful ablation atrial fibrillation, which obviously that would be wonderful to be in that category. So sometimes we might want to, depending on the type of atrial fibrillation you have, we might want to simply reduce the heart rate so that we can have your cardiovascular system reflect some normalcy, and that you don't have to have that burden of a high heart rate. And then sometimes we just want to focus on fixing the rhythm itself, which that's what I mentioned when I said you had a surgical procedure called ablation, successful ablation, atrial fibrillation. So in that case, we're trying to actually make sure you don't have that abnormal rhythm because the heart beats differently. So rate or rhythm, we might want to take care of the heart rate. We might want to take care of the rhythm. We have different ways of doing that. Okay, and I mentioned the patient-owned devices. I personally encourage you to use that. It's just that we have to marry our software together, or we have to find some way to have the provider or doctor be able to easily analyze the data that you collect. Okay, that's the end of the atrial fibrillation basic information. I wanted to start the conversation on atrial fibrillation. So this is the end of the medical information. If you want to see the spiritual information, please stay with me. If you do not want to hear the spiritual information part of the video, this is the time to click away. But first, please do like and subscribe. Okay, so for the spiritual information portion, I like to let my viewers know that I am a devout Christian. I am not trying to proselytize or turn you into anything, but I have noticed through the years, almost 25 years of medical practice, that those patients who have a discipline, a spiritual discipline, a religion, or even close family ties, they tend to have better outcomes. And the scientific literature does agree with that somewhat. So I encourage you to find a deeper meaning in your life, see a bigger story at play in your life. I have written 2 books. I'm working on my 3rd book. The first book is theological in nature. It's non-fiction. Although it's not fiction, I humbly submit that it's excellently written, and I encourage you to buy it. So this is the first book, called You're Saved, A Spiritual Perspective from a Doctor and Military Spouse. I am a doctor and I am a military spouse, and my name is Laura Tigler. So if you go to Amazon, you can type in You're Saved, Laura Tigler, and you'll see the 2 roses, and you'll know you're in the right place. And I usually like to end the video with a prayer. I have written a prayer after every chapter. I'm just going to randomly choose one. Let us pray. Dear God, thank you for not giving up on me. Thank you for coming into this evil world. And thank you for carrying me on your shoulders. I know you could end this world whenever you want to do so. I also know that you will not end this world until every soul that can possibly be saved will be saved. I know that you will never leave a Christian soldier behind. I know that you value our relationship and me. I know that I matter to you. Amen. See you next time.